Well, hello again. Our fourth time together. Great to see you. Again, I'm Dr. Steve Z. I'm one of the emergency medicine physicians here at Enloe Medical Center. And as you know, things are constantly evolving and changing around coronavirus and how we can provide the best care to our community. So we're bringing you this update again about a change in process of what you'll experience when you come to the emergency department. First thing you'll notice is I'm actually standing in front of the emergency department. So when you first come through the entrance to the emergency department, we're going to have a couple people here to greet you, but they're doing a lot more than greeting. They're doing an essential job for your care and for the protection of everybody who comes into our medical facility. They're going to ask you some questions, beginning the process about whether or not your symptoms might be consistent with coronavirus. So this is where it all starts, and then we have one additional step quickly that happens inside. So let's take a little bit of a tour just a little bit deeper in. When you first come into this area, you'll have an initial triage and registration process started. So let's suppose that you're a patient who, with this preliminary screening process here at the front door and a little bit further right here, is somebody that we need to have a higher level of concern about possibly having coronavirus. Then we're going to come back out and we're going to go to the new Modular. Here we are in front of the trailer or Modular. And if you're a patient who might be suspicious for coronavirus, then you'll be directed to come here. And this will be where you have additional triage and registration, as well as a waiting area and possibly even a treatment area for you. So let's take a walk inside and see what this Modular trailer is all about. Come on. In we go. One of the things I want to tell you is off to the right here when you first come in, you would see registration. Thanks for being here. And after you see the nurse at triage, then registration will finalize all the information they need to facilitate your visit. We're also going to have security here. Thanks. And security will be always present here in the trailer. And so nobody will ever be alone here. At a minimum, there will always be the nurse and there will always be security, and most often there'll be registration as well. So let's maybe just walk down towards the nursing area. This is where you would come in. The nurse will be in that chair. Patients will take a seat here. And so you could either be going out to this waiting area and sitting to go into the emergency department, or you might be actually seeing a physician here in the room next door, and if all goes well, you could actually be discharged from here as an option. Okay, so here's where you would be triaged, and if you're not felt to be somebody who needs to go definitely into the emergency department room, you could potentially see a physician here, and they might be able to address your needs. Now, as you know, the situation's really fluid, and a physician might discover things and say, on further reflection, I think you actually need to take a room in the emergency department, and so we'll work to do that as quickly as possible. On the flip side, it's possible that your care could be completed here and you could be discharged from the Modular. So that would happen here. And then if you take a look out here, what we've got is a seating area. We have a pretty large space, so a nice capacity to make sure that everybody's socially distanced. So in summary, that's the new flow process that you'll experience as you come as a patient to the emergency department. If you remember back to the spring when we first started talking, things have changed a lot, or because we're trying to adapt to this rapidly fluctuating situation. In the end, it's all about what we do together as a community and as a hospital. We've got to work kind of hand in hand and glove in glove. So stay safe out there. Please wear the masks, do the social distancing, make the good decisions. We're here for you any way that you need. Thanks a lot. Stay safe, stay healthy.